Professor Hennis. The gentleman here is Erasmus of Notre Dame. He is known for many, many very famous sayings. One of them is very relevant to the subject we are dealing with today. And with no further comments, it's my great pleasure to introduce to you Dr. Harvey Feinberg, he is the president of the Institute of Medicine, Washington, D.C., USA. And as I said before, he was the chair of the review panel who selected our two distinguished laureates. He was not known until the laureates were announced, but now he is open for criticism and especially for praise. Thank you very much, Harvey, for coming. Dr. Feinberg will introduce the two Dan David laureates. Harvey, please.
Thank you so much, Isaac. Good morning, ladies and gentlemen. It was indeed my great privilege to serve as the chair of the jury that recommended our laureates in preventive medicine for this year's Dan David Prize. Preventive medicine is a field that is defined not by a particular approach, but by a particular goal, an objective, very simply to maintain health, to prevent disease. And the reality is that there are many, many origins of disease and many ways to approach its prevention. As a result, many, many disciplines can legitimately lay claim to having a role in preventive medicine. Geneticists, biochemists, nutritionists, clinicians, epidemiologists, public health professionals, psychologists, behavioral scientists of all kinds, sociologists, anthropologists, lawyers, political leaders, and business and civic leaders all can play a part in affecting the conditions and the circumstances that either lead to health or lead to disease. As you can imagine, this left the review committee with quite a challenging task. And nevertheless, I think that you will find in today's two laureates individuals whose signal achievements and accomplishments render each of them a dynamic leader in the field of preventive medicine in accomplishing the goal of reducing the likelihood of disease, the severity of disease, reducing the numbers of deaths. And they have come at their task respectively from two very different vantage points, which I am now privileged to introduce to you. The first laureate who will speak is Professor Alfred Sommer. When Professor Sommer was a young epidemiologist, also trained as an ophthalmologist, a clinician, a researcher, he undertook a study in Indonesia looking initially at the effects of vitamin A supplementation on the visual consequences for young children, because vitamin A was known to have an effect on the ability to properly develop vision, and indeed blindness due to vitamin A deficiency was already a recognized problem. But what he found is very reminiscent of the statement of Louis Pasteur that chance favors the prepared mind. Because when he examined his data, what he discovered was not merely a difference in vision, but at first an absence of follow-up amongst the children, the newborns, the very young children in the control group. What was happening that they were lost to follow-up more often than those who were in the treatment group? And the answer, it turns out, was that they were dying more often. Indeed, they were dying at a rate substantially greater than those who were receiving vitamin A supplementation. This observation, which others might have set aside or indeed not even noticed, launched Professor Sommer on a decades-long quest. First, to understand whether this was a correct phenomena. And indeed, he was more skeptical than anyone at first. Could it be true? It seemed too good to be true. But the studies he repeated in Africa and Nepal verified the original findings. He went on then to develop a very simple supplemental treatment on an annual basis, a single treatment that cost 4 to 6 pennies per child, that would on average increase their survival at a later estimate showed by 23%. And as a result, from a World Health Organization estimate that there are 250 million children in the world who are born into circumstances where they are susceptible to vitamin A deficiency, this very simple treatment has proved to be life-saving for millions of newborns born into poverty around the world. Over time, Professor Sommer also championed the idea, championed the policies, helped develop and articulate the national and global programs that now provide this life-saving treatment to millions of children today and into the future. Now, the problem of poverty is precisely the problem that has gripped our second laureate in her career, Professor Esther Duflot. Professor Duflot brings the tools of economic analysis to the questions of what it is that can be done very concretely to improve the life circumstances and chances of those born into poverty and living in poverty. If you talk to her or see any of her work, you understand in an instant that she is not merely sympathetic, but deeply understanding of the peculiar circumstances that grip those living in poverty. And her work is important for the prevention of disease for two reasons. First, poverty itself is well understood as a predictor of ill health and premature death. But also, in her investigations, she has selected specific, important interventions to evaluate, to ascertain what exactly would work, how well does it work, what are the choices that should be made by policymakers. For example, consider the problem of malaria, which is estimated to kill 1 million people every year in the world. There's a well-known, established, preventive approach, which is to take insecticide-impregnated bed nets and enable people to sleep under these bed nets at night, because the mosquitoes that transmit malaria in many parts of the world are night biters. So if you protect the sleeper from the mosquito, you can reduce dramatically the incidence of malaria. But now the question. If you want to help very poor people to protect themselves, is it better to give them the bed nets for free, or should you charge them perhaps a little bit, or maybe a little more than a little bit? What would work better? I can tell you in a very different circumstance at our national academies when we were considering how to distribute copies of our reports on PDFs. We did an experiment in which we took those who were ordering books and we offered them a PDF either for free or for a small amount of money. And in that experiment, it turned out that more people requested the PDF when they had to pay a little bit than when they were offered it for free. So economically, do you value something because it's offered with a price? Or do you want it more if it's free? Now, we could speculate for hours how the poor would resonate. We might even come to the question with a predetermined values that tell us, no, we must either charge something because we believe in the principles of the market, or we must give it for free because we care about the poor. We want people to get it. More will get it. So what's the correct answer? The debate went on for years. Professor Duflot answered the question, and I think she will tell us in the course of her remarks, so I don't have to. What is the correct answer to this question? When you think about the ways in which you can affect health and you can prevent disease, they are innumerable. But what is striking about these two individuals, one dealing with a micronutrient and the other applying microeconomics, is that in both cases they have advanced knowledge and applied answers that literally are macro solutions that can save and make a difference in the lives of millions of people every year, now and in the future. And so I think it was very fitting for the directors of the Dan David Prize to affirm the selection of Professors Alfred Sommer and Professor Esther Duflot. Like you, I am looking very much forward to their presentations this morning, along with those of our other presenters, talking through many dimensions of the prevention of disease. So please join me in congratulating again and welcoming first Professor Alfred Sommer and then Professor Esther Duflot.